nearly every condition that people are coming in with is almost always tied to the pre-birth posture. And that seems ridiculous to a lot of people, but the fact that, for example, if I'm sitting here and I've got this leg crossed over the other one, that's almost always the same. With people, they have one leg that they prefer to cross over the other one. And the reason that this one is up higher and this feels more comfortable, and it's the same position that I will sleep in unless I'm cognizant of it, is I'll pull this leg up when I'm sleeping at night. And the reason for that is this leg was pulled up higher in the womb than this one. This leg is typically a little bit shorter than this one, because if this is pulled up higher, this iliacus muscle is shorter, that attaches to the front of the hip, and then it rotates the hip forward, which then causes a leg length discrepancy. When I stand up, if that's the case, and this is shorter and it's pulled forward, then that's going to pull the hip forward, which is going to pinch nerves in the low back, which can cause sciatic nerve pain, hamstring pulls, calf strains. All of those things are all a result of this iliacus being too short and tight from pre-birth posture. So when somebody is sleeping, their focus is getting comfortable, and the only way that you can get comfortable is to shorten muscles that are already contracted so they stop pulling at the attachments. So, and I wouldn't do this hard, but if you pull your hair, your scalp will hurt, even though there's nothing wrong with your scalp. So what really is the problem? The problem is that if you look at this is the muscle, these are tendons, and then your scalp is the bone. If I'm pulling on this, that causes pain, it causes inflammation, it causes discomfort. And so to get this to stop hurting so that I'm more comfortable, I can just let this go or shorten it so I'm not now pulling on it. So same thing happens with the human body all over the place. And if you've ever seen an infant, I just posted a video of this infant that was inside the sac that it comes in, and it's clear. And so it was one of the few babies that's actually born inside its womb. The baby's just completely just folded up. So imagine being in that position for months without the ability to really stretch out. And so when babies are born, they have the appearance of being super flexible. But the reason the appearance is there is because the joints have not formed yet. The ligaments and tendons in the joints are really, really like mushy. The babies are born with no kneecaps because they just haven't formed yet. So if the muscles are really, really tight, but the joints are really loose, the appearance is that they're very flexible and bending. And everybody says, boy, I wish I was that flexible. No, you do not. Because those muscles are really tight and contracted, and they're pulling at the attachments. And the only reason it doesn't hurt initially is because the joints are so loose. After several weeks, the joints start forming, so they become firm, and then the muscles are still tight and contracted. And they will pull your body in ways that cause it discomfort. So if you have an infant and you hold it and you're holding it, and parents out there can relate to this, they're holding the baby and it's all like this, and they're holding it, and they finally get it to go to sleep, and they carefully walk it over to the crib, and they lower it down really slowly, making sure it doesn't do this, and get it down here, and they just get it out, and they put it down. And then it goes, because it opens up, and now these are pulling at the hips and the legs, and these muscles are pulling at the neck and the head and the shoulders, and it's like pulling really hard on those areas, and they wake up because they're in excruciating pain. Doctors will say the baby is actually not in pain, that this is just a normal part of it's a normal part of the process because we're so big and we're in this really small space, and it's normal only because everybody goes through it. But does that mean that that is the best way to proceed? And my contention is no, it's not. Most babies, if you work on them and you get them completely opened up, they end up sleeping like this, where their arms are up, their legs are out, and they're just completely comfortable in this position. Not folded up into a fetal position, but actually opened up where they can actually be comfortable here. Now this dog wasn't always this way. Her left hip was really messed up and now it's open, and so she can actually pull on this. You can do whatever you want to with it and she won't bite you. Well, she would bite you, but she won't bite me. But this because this isn't painful anymore. Same thing happens with babies. You get this hip opened up, then you get this hip opened up, you get their QLs opened up in the back here, you get their shoulders opened up, their neck opened up, and then they're comfortable in a neutral position. If they're comfortable and they don't have pain anywhere, you know what that does to their brain? It just opens their eyes. These babies, and one of the things that people notice, I'm holding a brand newborn baby that we just got all opened up and their eyes are wide open. And they're making eye contact and they're looking around and people are looking at the baby like, holy cow, how in the world is that baby that aware of everything going on? Because these babies sometimes come in and they're like almost staticky because they're in so much pain. And you get done and they're just, it's like they took a deep breath for the first time where their body isn't full of pain. Everybody's had the experience, most people have had the experience of having the flu and having body aches and pains through their entire body, like head to toe. I asked myself the same question the last time I had the flu, and this was years ago, but I was like, I've been a body worker for over 30 years now. I said, why are these muscles hurting? Why are they tight? I actually wrote down all of the muscle groups that were painful to me. I wrote them all down. When I was over the flu, completely done, like by a month, I went back, got my list, and I pushed into each of those areas. They were still sore. I was just unaware of it because that's the background noise that we have once you acclimate to your surroundings. Our bodies are built for survival, and if we were aware of all the pain in our bodies 24 hours a day, 7 days a week, we couldn't function. Okay, that's the condition you are with the flu. All that happens when you have the flu is the pain and the things that are going on with your body. It actually overrides your ability to ignore all of the background noise and the pain and all the dysfunction in your body, and you're aware of all of it all at the same time. And so you can't get over that. But here's the interesting thing. My belief is that all of that pain that you have, the muscle tension and tightness and aches and all that kind of stuff when you have the flu, are just vestiges of your pre-birth postural deficits that have been with you your entire life. It's your background noise. It's the thing that distracts you. It's the thing that sucks energy from you, because a contracted muscle is not going to facilitate movement. It's going to restrict movement. And if you're trying to move through any type of range of motion, that's going to restrict you and cause, it's like having your brake on while you have the gas pedal on. And so that causes friction, tension, loss of energy, all of those things that happen, and it is a distraction from your ability to actually learn. The babies that we're seeing are consistent across the board. Doctors, the doctor that delivered them always asked the parent, how old is this baby? Because the baby is performing so far above their age level in just about every single metric that they can't believe this is the same baby that they helped birth. So it's mind-blowing, the consequences of all of those things. We're going to put together an online training course to show people how that they can actually get these things opened up, not only in the States, but in third world countries and stuff like that, where they don't have access to a lot of medical treatment and care. This is not that complicated. It basically is, this technique works so well because it's really relatively simple. If this thing is really tight through here, and this comes down across this area and attaches to that bump, and this thing was pulled up way higher in the womb than the other side, then lengthening this is going to be really important. So the primary thing that I'm doing initially is I'm getting in to this area. Usually with an infant, you're talking about one finger, and you're holding it in this space because it's much smaller. And you're just shortening this muscle until this softens a little bit. And you'll tell it softens because they'll stop crying as much, especially if this is really tight and contracted. And then you can start working it up and down and in and out through that range of motion to get this thing to calm down so it stops pulling, and eventually you'll get this leg all the way out and all the way through different ranges of motion. And that's, so what you're doing is you're blocking blood supply to a muscle temporarily so it can't get oxygen, so it can't contract. Because without oxygen, the muscle can't contract. If this can't contract, it has to relax. When it relaxes and you pull it through a full range of motion, very gradually, then you're actually taking this, which is like bunched up cellophane, and you're pulling it back to its original position. Once it gets to here, the pain goes away.